Today, we're going to talk about week 2 of the Deferred Resignation Program. I know that not a lot of people, especially the ones I know, maybe others are getting better information, but we are about a week and a half away before you have to make a decision. So I want to make sure that what I am learning, I'm sharing with you. Again, this is just for educational purposes. You'll still have to kind of talk to HR and find out some more information, but this is what's being shared by our HR staff. And I'm super grateful that they are forward thinking and willing to share. So, a recap of the portal. So, this is for the VA. It is a Power App portal. If you've submitted a request, it would be either listed here. And if you have any questions, definitely look at the DRP bulletin. It gives you more details. You can contact HR. And then also, they are working on the DRP FAQ. It was supposed to be out today, but I went to a wedding, so I didn't get a chance to look that up. I will try to keep you updated as soon as I learn something. And then look at your general retirement benefits. I'm going to go share some information with you as we go over some separation benefits, basically your TPX or job aid, so you can update your service card. I went through this last week with regards to how to submit your request for the DRP. It's pretty simple. Now, with week 2, this section right here, what qualifies as either your position as supporting direct care to veterans or your position doesn't. They want you to make that determination. You can take a look at what's listed in attachment A. How do you see yourself as far as providing direct patient care? Look at the sample list that I'm sharing with you. You have, of course, the clinicians, but you also see police officers, housekeeping aide, and food service workers. Food service workers, they deliver food to hospital beds. Housekeeping aide, basically, they're part of infection control. And police officers, they handle patients with behavioral disturbances. And then you have the ones that are not direct patient care. You can see administrative nurses. Technically, they're clinical staff, but they're providing administrative functions. So that's what they mean by you determining what type of role you play. So this is the decision tree. So far, this is what's been outlined in the bulletin. A lot of things are coming out as pre-decisional, so I'm not sure if things are going to change, but definitely check with your HR how things are supposed to flow. When you submit your request through the portal, it's supposed to be reviewed by HR and the workforce management. They determine based on your job description and what you've submitted, whether you're exempt or not. The not exempted, if you're not on that attachment A list that's in the bulletin, those are like the exempt positions. And then you have to determine whether you provide direct patient care or not. But with what I outlined earlier, it seems like if you have direct contact with the patient, and then they make the determination based on what was submitted. Your medical center director will review and make the decision. And if you are one of those exempted direct patient care, that can actually go up to a secondary review. That could be up to VACO. And then they come to a decision point based on that, depending on which direction you're going to go, whether you're approved or denied. Either way, you're going to be notified with the decision. If the settlement is signed, you get to determine when you want to start your authorized administrative leave. Some people decide to stay a little bit longer if they want to finish up projects, and some people just decide, I want to go now. They're leaving that up to you. You have up to the time you have to sign the settlement to decide, you know what, I don't want to go through with it. These are the proposed timeline. Again, things change. So the end date is 4/30/2025. So you have about a week and a half if you want to submit your application for the DRP. They don't know when your MCD is going to review it, and they don't know when the signatures for the settlement agreement or the denial is going to be provided. They said here the target of AA started depending on settlement. But this one, I want to double check. Continue to listen to the VHA hotline conference call, because from my understanding, like last Friday, they mentioned that they would like to have the AA start and have all of this settled by July 1st. So this is something that's subject to interpretation. And then the DRP for this particular round will end on September 30th. Okay. I got this from an HR specialist from our visit. It is not vetted, but it's a compilation of information. Take a look and do some research with regards to separation benefits that are available to you. Now, with health benefits, you can take a look at seeing if there can be a temporary continuation with your healthcare. Now, with regards to insurance, I would take a look at your GRB and get your total compensation plan to see what that actual cost is, and then maybe price it out to see what's available for the federal group life insurance. I'm a licensed agent, so I can share this. Basically, this is term life. And it will increase, and it's in increments, like specific age range. I would look at other coverage to see what is more affordable, and there's actually coverage out there as far as your monthly premium payment. So look for what you can afford, especially with your budget. If you do want to continue and keep it, make sure that you take a look at this continuation of life insurance coverage. And when you are either doing voluntary or early retirement, make sure you talk to your retirement shared services office and do that estimate. They will look at all of your benefits in health, dental, vision, and life insurance. I would ask for all of it so you can see how much it costs. And if that's something that you want to continue, if you're married, maybe hop onto your spouses. If you're not married, take a look at what's out there. But here is the Thrift Savings Plan. And I know I've talked about this before. I would go to the website and take a look at what their requirements are as far as withdrawal. Just remember that it is a taxable income and you will have to pay taxes, and there's a penalty if you are younger than 59 and a half. So that's something that you have to consider. If you are going through a hardship withdrawal because you need the funds, due to separation, you have to wait to submit it until after you're actually separated from the VA. So that won't happen until 9:30. If you decide to take the DRP, if you want to leave it there, if you want to transfer it to a different plan, maybe you're eligible for monthly payments, especially if you're eligible to retire. And if you have a TSP loan, it has to be paid in full within 90 days of notice. So make sure that you either can pay that payment or maybe talk to the TSP representative if the funds within your TSP can go ahead and pay for that when you do rollover. Oh, this one I thought was interesting. So you can actually get a refund of your retirement contributions. So if money gets tight and you are less than 5 years, you're not quite vetted for deferred retirement, then maybe that's something that you can request to see if you can get a refund of your contribution. Again, you're just stacking your funds to help you get through and maybe cover your expenses. And I'm going to put this document into a Google Drive. You can take a look at it and do your own research, look at your annual leave, make sure that is correct because you can get paid lump sum at your final paycheck with your annual leave. And then as far as sick leave, if you are retiring, that's going to be credited towards your total federal service and that'll count towards your annuity. And if you are just trying to get to that vetted time of 5 years or maybe even just do a deferred retirement, that's going to count towards that. So understanding your service card. This is something that was provided as a job aid. Take a look at it because you want to make sure your service card is up to date, your EOPF, your electronic personnel record, is up to date because that's where they're going to pull a lot of this information. If you decide not to take the DRP, you want to make sure that everything is correct. Your education, your veterans preference, because they might go with seniority. Follow this and do the work for yourself because HR is getting inundated with having to manage all these short suspenses, plus having to care for all these different requests and updating them. Help them by checking your own service card. Also, I'm going to share this on the the description below. This is the link to OPM's reduction in force to give you a summary. Take a look at the benefits. So you stay informed, and that way you can be prepared. Talk to your HR representative if possible. Submit the trouble tickets through HR Smart. Get your own guidance. Be patient with them because they're trying to process all these requests ahead of time. They want to help you. And if you are eligible for early retirement or voluntary retirement, contact your retirement service office and see what that estimate looks like for you. Continue to visit OPM. I'm going to look for any FAQs that might be available for us, especially with DRP 2.0. I know by gaining the knowledge and taking action, it helps kind of alleviate some of it. This way you are prepared and make a good decision. As far as updates from the VHA hotline conference call, not a whole lot of changes with DRP or any of the timelines. They did mention something about possibly having a separate item for Vera outside of DRP. Right now, with voluntary early retirement, you can only get with the DRP. They're also looking into the voluntary incentive severance pay. They don't have anything concrete yet. So make sure you look into that. If you are eligible for retirement and you decide not to take the DRP, but you are RIFT, there's also the discontinued retirement program that might be available to you. So that's a different set of requirements, but that's something to really look into. So if you look at your total compensation plan, it is in there. It'll give you a table if you are eligible for early retirement or discontinued service retirement, DSR. So that is what your annuity will look like. Take a look at that and prepare. I hope this was helpful and will continue to share what I learned because I know we're running out of time and not everybody is getting the information. And I want to make sure that we look out for one another, look out for your HR people. And if you feel comfortable telling your supervisor, give them the heads up so then this way they can plan as well. I know this is stressful for everybody, but the more we just continue to serve one another, it can make the environment a lot better. If this was helpful, click like, subscribe, and share. Have a great day. Bye.